Anxiety and panic attacks are terms often used interchangeably, but they refer to distinct psychological experiences with different triggers, symptoms, and durations. Understanding the differences between these two conditions is essential for accurate diagnosis and effective treatment. This report aims to provide a comprehensive comparison of anxiety attacks and panic attacks. Definitions and overview. Anxiety attack. An anxiety attack, sometimes referred to as an anxiety episode or situational anxiety, typically occurs as a response to specific stressors, situations, or triggers. These attacks are often proportionate to the perceived threat and generally subside when the triggering factor is removed or resolved. Symptoms are milder compared to panic attacks and may include increased heart rate, excessive worry, trembling, restlessness, and muscle tension. Panic attack. A panic attack, on the other hand, is an intense and sudden surge of overwhelming fear or discomfort that occurs without any apparent external trigger. These attacks are often disproportionate to the situation and may happen unexpectedly. Symptoms of panic attacks are more severe and can include a racing heart, shortness of breath, chest pain, dizziness, depersonalization, and a sense of impending doom. 2. Triggers. Anxiety attack. Anxiety attacks are typically triggered by specific stressors or situations. Examples of triggers may include public speaking, a job interview, a difficult conversation, or a phobia such as fear of flying. The onset of an anxiety attack is directly related to the triggering factor. Panic attack. Panic attacks can occur without an obvious or specific trigger. They may be spontaneous and unrelated to a specific situation. Panic attacks can also be triggered by stimuli that cause extreme stress, such as a traumatic event, but they often happen out of the blue. 3. Duration and onset. Anxiety attack. Anxiety attacks tend to have a gradual onset and a longer duration. Symptoms may persist for hours or even days, depending on the triggering factor and the individual's ability to cope. Panic attack. Panic attacks have a sudden and intense onset. They often peak within minutes, with symptoms subsiding relatively quickly. A full-blown panic attack rarely lasts longer than 30 minutes, but the after-effects can linger. 4. Symptoms. Anxiety attack. Symptoms are generally milder and more specific to the triggering factor. Common symptoms include excessive worrying, muscle tension, restlessness, and difficulty concentrating. Physical symptoms like an increased heart rate or mild shortness of breath may be present but are not as severe as in panic attacks. Panic attack. Symptoms are severe and often include a feeling of impending doom. Physical symptoms such as a racing heart, shortness of breath, trembling, sweating, chest pain, and depersonalization are prominent. People may feel as though they are having a heart attack or going crazy during a panic attack. Response to medication and treatment. Anxiety attack. Anxiety attacks often respond well to cognitive behavioral therapy, CBT, lifestyle changes, and stress management techniques. Medications such as selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines may be prescribed but are generally used for more severe anxiety disorders. Panic attack. Panic attacks may require a combination of therapy and medication. Antidepressants and anti-anxiety medications are often used to manage panic disorder and recurrent panic attacks. CBT is particularly effective in treating panic attacks and panic disorder. Conclusion. Anxiety attacks and panic attacks are distinct experiences with different triggers, symptoms, durations, and responses to treatment. Recognizing the differences between the two is crucial for healthcare professionals and individuals seeking help. Accurate diagnosis and appropriate treatment can significantly improve the quality of life for those dealing with these conditions. Furthermore, understanding the differences can reduce the stigma surrounding anxiety and panic disorders, promoting empathy and support for those who suffer from them.